Trauma, a bodily injury that can be anything from simple and trivial to serious and life-threatening. Trauma injuries can range from road traffic accidents, sports injuries, accidental injuries, and falls to natural disasters, communal violence injuries, industrial accidents while working, and so on. Did you know that trauma is one of the leading causes of death and disability worldwide, with particularly devastating effects in India? Of the 1.5 million deaths worldwide from trauma-related injuries, 13% come from India. So how do we save these lives? How do we provide an effective and sustainable trauma and acute care system in India? This is the question that Marengo Asia Hospitals has set out to find answers to. In 2023, 1.7 lakh people were killed in road accidents in India. That's 474 lives lost every single day. And one death practically every 3 minutes. These are frightening statistics that highlights just how critical trauma care is in India. Yet, just how much of a void needs to be filled in terms of bringing more attention to trauma care. This is the guiding vision at Marengo Asia Hospitals, where the services in the trauma center are elevated to deliver what patients need. With more than 1,700 beds and 480 doctors, this network of multi-speciality hospitals focuses on providing tertiary and quaternary care, creating centers of excellence across medical specialties and adopting a patient-first approach. The ethos of this healthcare institution is built on the 4 A's: awareness, affordability, accessibility, and accountability. Marengo Asia Hospitals have been raising the bar when it comes to trauma care in India. With this idea at the core of what they do, Marengo Asia Hospitals organized the first ever international conference on trauma and acute care. Delhi Boston chapter, a coming together of healthcare practitioners, experts, and thought Marengo Asia Hospitals, who explored ideas, innovations, and the latest advancements in the field of trauma and acute care management.
Respected dignitaries, there are a lot of people in the crowd, and I don't want to be disrespectful to anyone, but everyone who is here, they are here because of the gravitas they carry and the kind of work they have done till today. This inaugural international conference of trauma and acute care we call as ITACC. Since morning, the content of the discussion has been amazing, in fact. Nobody left this room irrespective whether it was tea time, lunch time, and whatever, and till now people are there because the content which was presented by the speakers speaks volume about it. We have more than 540 odd registrations which we have received. This speaks volumes.
In the 2-day conference, perspectives on trauma care in India were shared by diverse sectors, policymakers, and government authorities, along with the insights of health experts from Massachusetts General Hospital, USA, and the National Health Service, UK, with a special focus on road safety and trauma management in the armed forces.
Marengo Asia Hospital, right from the time of inception, we have been focused on one thing, that our prime objective is to save lives. And in trauma constitutes the biggest threat for the society. If you look at the data, last year 1.7 lakh people died on road traffic accidents in India. 434 people are dying every minute. So as we speak, there is somebody who is dying because their patient has not reached the right place or has not been treated by the right people, or we do not have the capability to deal with this. With this conference, we thought of creating an awareness and pick up the best components which can be replicated all across the country. And we want to again bring back to one key highlight to all the stakeholders in healthcare, that in addition to heart attack, stroke, TB, malaria, other illnesses on which people generally focus, trauma requires equal attention of everyone because it is emerging as a key killer for the population.
And it is precisely because trauma is emerging a key killer for the population that this conference was more than a coming together of experts. It also marked the beginning of a collective commitment to transforming trauma care in India, leveraging international collaborations, share best practices, and adopting innovations to improve outcomes for trauma patients.
And then we have the people, the nuts and bolts of the operation, the surgeons, the physical therapists, the occupational therapists, the anesthesiologists, the nurses, the administrators, all of the people that are the cogs in this system that make it work. Rehab services post-trauma are a huge part of this that we often don't talk about when we're talking about this on a global scale. Injury prevention is part of trauma systems management, and so is quality improvement and research, which is how many of us do this work academically. When we look at the various components of a trauma system, this is a slightly different way of looking at the previous slide. But in addition to people, you need leadership. In addition to a system, you need a system that is willing to adapt and develop over time. We need to constantly evaluate what we're doing. We need to prepare ourselves for disaster, and we need to study what we are doing, because if we don't study what we are doing, we have no way of measuring the impact, no way of scaling what we're doing to a broader context, whether that be within India or around the world.
By bringing in global perspectives and experiences in trauma care, the conversations provided a unique learning opportunity for healthcare professionals to come together and explore the latest developments in trauma management from all over the world.
You do realize that trauma is something that comes unexpectedly. And this beautiful family having a happy dinner, literally in a few minutes, may end up with some of them dead, some of them in the ICUs fighting for their lives, and they were never prepared for that. The point here being that if you do not plan ahead of time, if you are not ready with a full national or at least regional trauma system, you will never be able to save lives. As opposed to other areas of surgery, of medicine, where we do have the luxury of acting after the event, of planning and treating a patient after the diagnosis of cancer or heart disease. In trauma, everything has to be done in advance because it is unexpected, it is unpredictable, it can happen to each one of us, each one of you, and we have to be fully prepared. And it's not just an individual issue, but it's a group issue too, as we in Boston know very well, when about a little bit more than 10 years ago, we had an event that nobody would ever think it would happen in a city of education, in a city of medicine, in a city of intellect and light, and nobody would ever happen that a terrorist event would happen to Boston. And if it can happen to Boston, it can happen to Delhi, it can happen to Mumbai, it can happen to Chennai, it can happen to Kolkata, and it has happened, as you very well know, when you had the Taj event many years ago. But this is a great celebration that suddenly, because of some deranged individuals, is converted in 2013 in a scene of horror where our fellow civilians, Bostonians, are lying on the pavement with legs exploded and major injuries from 2 bombs that were placed in one of the most celebrated events in Boston on Patriots' Day at the Boston Marathon event. This type of collaborations are extremely important because they are bi-directional paths for exchanging knowledge. For example, the United States and India, they can learn from each other and teach each other, and with a combined knowledge, then the care for the trauma patient advances. The Massachusetts General Hospital is the largest level 1 trauma center in the Northeast, and it is also the #1 research institution in the United States. So research and the production of knowledge for the care that we deliver to our patients in the future is one of the core missions. And as such, all the methods that are being developed at Mass General can and should be exportable. So I think that Mass General is not only contributing to the care that we deliver today around the world, but also to future care and the things that we will be able to do tomorrow in order to save more lives from trauma.
As the largest shareholder of Marengo Asia Hospitals, we are quite pleased with the way things are taking shape. Clinical excellence and patient experience has been at the center of what we intend to do, and we've come a long way in the last 3 years. Partnerships as well as collaborations is something that we certainly want to embrace and encourage at Marengo Asia Hospitals. Our first partnership with Werfen led us to the first bloodless heart transplant in the country and in Asia.
The event also witnessed the inauguration of the Bhisham Cube, Bhisham or Bharat Health Initiative for Sahyog Hita and Maitri Cubes are portable medical kits which help in expeditious treatment of people with injuries, saving their lives. Each Bhisham Cube stores medicines and equipment for the first time of care of all kinds of injuries and medical situations. It also consists of surgical equipment for a basic operation room that can manage 10 to 15 basic surgeries per day. The cube can handle about 200 cases of diverse nature in emergency situations such as trauma, bleeding, burns, fractures, etc. It can also generate its own power and oxygen in limited amounts. Another focal point for the event was exploring trauma care in the armed forces, delving into the unique challenges that come with the diverse terrains and situations encountered by those in the army. Through conversations led by experts in the field, tailored approaches were discussed for managing trauma in the armed forces.
Why is it that combat trauma care is important? Why is the care part of combat trauma important? The most important thing is it's a morale booster. When a soldier is going into combat, if he knows that he is likely to get good care if something happens to him, that for him is the most important thing. The second most important thing is it helps in preserving trained manpower. If you go back 500 years, a soldier who sustained an injury, no matter how trivial, would be sent back, But now with greater care and availability of trained manpower, you know that he doesn't really need to be sent far back. He can be put to use in other roles quickly, so you can replenish the front line quickly. And of course, this entire process then reduces the cost. The Indian experience is a little different from most nations because we happen to have the highest heights, we happen to have dense jungles, desert, and depths. We have a 7,500 kilometer coastline.
Trauma is a leading cause of death and disability in India, with reports suggesting that trauma accounts for roughly 10% of all deaths in the country. However, trauma care systems in India are still at an early stage of development. With evolving education and practice in trauma life support skills, it is necessary for us to have a developed trauma management system across the country. And to accelerate our journey towards the goal, Marengo Asia Hospitals has been actively involved in raising awareness not only for the general public but also medical professionals by conducting seminars and conferences, of which this event, the International Conference on Trauma and Acute Care, is a key example.
So what we have today is the huge need to develop the trauma care which is reasonably quality care. I would not say on the top, but at least if we can handle majority of the trauma, minimizing the disability, minimizing the off work, I think that is what something we would like to achieve.
Through the course of the conference, insights from across the medical field were shared, widening the horizons of our collective understanding of trauma care.
Rajiv and I were chatting about the possibilities, and I'm very fortunate that Marengo Asia and Dr. Singhal have taken this one step to arrange this conference. At Mass General, we have Dr. Codman Center of Quality, and Dr. Codman was a surgeon ahead of his times. And he suggested that every hospital should follow every patient it treats long enough to determine whether or the treatment has been successful, and then to ask the questions that if not, why not? And with the view to prevent certain failures in the future. And so we are trying to develop a system that has redundancy and reliability, and going from a system of culture of blame to a system where we can actually measure and improve outcomes. Most of the time, we do right things, most of the patients, but we need to go to a system where we need to do all the right things for all patients at all the time, particularly in trauma.
Trauma care in India is going through a lot of transition, and it's a great opportunity to collaborate globally to increase awareness and increase education in trauma care. And so I think government hospitals, hospital bodies, as well as societies such as the trauma societies all need to come together to build something like this, what Marengo is trying to do, so that we can all come together and improve trauma care. I think the future is tremendous. I think events like this will get all the key stakeholders together, and I think we can build something which can leapfrog the trauma care in India.
The forum also brought attention to the fact that in taking trauma care systems towards excellence, the role of the people who work to make that happen is just as important. It is the trauma specialists who work at the front line, attending to patients firsthand, giving them the immediate treatment they need to be able to survive the impact of the trauma. The conference also received appreciation from Shri Nitin Gadkari, Minister of Road Transport and Highways.
We've learned a lot. I want us to kind of pull back, and we're going to think just about what the future of trauma can be. And I want to start by acknowledging what Lao Tzu tells us, which is those who have knowledge don't predict. Those who predict don't have knowledge. Now, I was asked to talk about the future of trauma care. So perhaps I'm the one without knowledge on this dais right now, and I will say I'm both honored and humbled to be giving this lecture. So our future world is going to be older, it's going to be technologically booming, and it's going to be increasingly innovative and integrated. So if we agree on that, is there anything that we can think about that will help us predict the future of trauma care? I think there is. Trauma developed from military applications, military surgeons, many of whom we've had the fortune of hearing from today and yesterday. Their expertise was adapted in the civilian sphere, specifically to young men who got into a lot of high energy, blunt, and penetrating trauma. As that, at least in some countries, has waned, trauma surgery further adapted to be mostly about high energy, blunt trauma. We developed protocols that we've talked about, different therapies, modalities. It's the constant evolution of the trauma surgeon. The next evolution will be caring for geriatric trauma patients. Our world gets older, our patients are older. So be it, we'll care for them too.
Marengo Asia Hospitals has taken rapid strides in advancing trauma healthcare through its gold standard services and the cutting-edge technology used across its centers and institutes, from the first bloodless heart transplant in Asia and the first successful bilateral lung transplant to the first schizophrenia surgery performed in India. Injuries and accidents are an inevitable reality of life, which can devastate families and lives. How much we're able to save our patients from these events depends on exactly how prepared we are to address trauma cases that happen around us every day. Healthcare is an ever-evolving, constantly changing field with new learnings every day. Healthcare can be responsive and and strengthened only when every single person involved brings their expertise to the fore, and when institutions like Marengo Asia Hospitals keep pushing knowledge systems beyond their current boundaries.
I think what today we have decided and discussed, together we can change the face of trauma care in times to come, and maybe 3 years, 5 years down the line, we'll have a very different statistics as Sweden is moving towards zero. Indian government has come with the intention of saying that by year 2030, if we can reduce the mortality coming out from road traffic accidents by 50%. So I think every country has a benchmark and a goal, and every individual will have a role to play in achieving this. Neither the government of India can do it alone, nor few handful of people who are here, they can do it alone. We all have to work, all agencies have to work so that we are able to basically reach that target of reducing the mortality, of reducing by 50% by year 2030. Thank you once again, and sincere appreciation to everyone and all the people who have put their hard work in trying to make this a great success. Thank you very much.